South African health scientists continue to make their mark on the global stage. Professor Helen Rees has received the coveted World Health Organization's prize for outstanding contribution to public health. Now, the executive director of the Wits Reproductive Health and HIV Institute and professor in the Department of Obstetrics and Gynecology at Wits University has been honored for a life spent shaping public health. Her distinguished career includes defiant clinics of apartheid-era Johannesburg to influential policy halls of Geneva. As the world's health architecture falters, Rees draws from an unscripted career forged in crisis and an unwavering conviction in human rights. Now, health expert Professor Helen Rees has been honored with the World Health Organization's prestigious Dr Lee Jong-Wook Memorial Prize for outstanding contributions to global health. Dr Lee Jong-Wook Memorial Prize for Public Health was established in 2008 in honor of Dr Lee Jong-Wook, the 6th WHO Director General who dedicated his life to underprivileged. It consists of a plaque from the founder and some money which will not exceed $100. She joins us now to share this achievement. Good evening, Professor. Thank you very much for joining us on the program. Firstly, congratulations on your award. How does it feel to be honored for a life spent shaping public health?
Well, it is an honor. I mean, that's the first thing to say. And it really, the way that it was put to me was it is a reflection of an entire life's work. But a lot of what I've done has been teamwork. It's been in my institute, it's been on various committees and boards and think tanks. It's always teamwork. It's not only you yourself, but it clearly is wonderful to get recognition.
Quite modest of you, but yours is a long and acclaimed resume. Born in the UK, then you came to South Africa, working in impoverished communities such as Alexandra Township, and then transitioning to academia. Just take us through that which motivated you to move from the clinic corridors to academia.
Well, I think it was a sort of a comedy of coincidences, if you like, because, as you say, I was always politically active when I was a student in the UK, and I trained there as a doctor. And then I came with my South African husband in the early 80s to South Africa. And because of our commitment to the whole anti-apartheid struggle, we were part of a doctors' organization called NAMDA. And we worked extensively in various ways to try and undermine what was going on in the apartheid health services. So when the democratic elections came, I was asked if I would set up a research unit that was then focused on reproductive health and HIV that would start to address the needs of the majority of the population, which had been neglected in terms of research.
And I take it that specific institute would have been the Wits Reproductive Health and HIV Institute, which happens to be one of South Africa's leading research institutions. Am I correct?
That's correct, yes. And led by not just me, led by a number of absolutely excellent scientists. And as you say, South Africa does have really world-class scientists, particularly in the fields of clinical research. And obviously HIV has had a lot of attention, quite rightly.
And you've developed prevention tools such as PrEP. And when it comes to PrEP, my heart always sinks every time, Professor, when we look at the stats of new infections of HIV. And I just think, how are young people not aware of PrEP? Is there enough awareness, or it's a treatment compliance issue here?
Well, there is awareness, and one of the sad things about the recent cuts from the US government was that we had a very large program in 7 provinces that was reaching out to schools, to high schools, promoting PrEP and contraception and HIV testing, etc. And that, of course, has had to stop. But it's going to be very important that the services that we've set up to deliver PrEP, that stands for pre-exposure prophylaxis, are really maintained, because there's a new product in the pipeline that we're very excited about, which is a twice-a-year injectable that is almost 100% effective against HIV. So we need to keep those prevention services going, as you say, particularly targeting young people who continue to be at risk.
You touch on the freezing of aid from the United States. Now, specifically, your Wits RHI also faces uncertainty. We understand that everything is just up in the air right now. Any alternatives to mitigate this loss of aid?
Well, I don't think we're going to see nobody could step in to replace the amount of money that was being given through the PEPFAR program to support services. And we're not expecting that. Instead of that, what we're trying to do is to say, how do we, in the short term, bridge that gap so that we ensure that people are on treatment, stay on treatment, including vulnerable people and people who are hard to reach. But as I said, also, how do we maintain a prevention service? So that is a short-term solution, but I think in the medium term, we're going to have to think more creatively about how we deliver services in a more cost-effective fashion, because funds are going to be restricted. On the research side, there are other donors and supporters who are still giving research funds. So many of the researchers, as I say, excellent researchers across the country, are regrouping and rethinking and redesigning the research agenda once more.
Professor, congratulations yet again. Thank you very much for your time this evening. That's health expert Professor Helen Rees, who has been awarded the World Health Organization's prestigious Dr. Lee Jong-Wook Memorial Prize for her outstanding contributions to global health.